Um, Good evening, everyone. I'm Dr. Scott Mesh, Director of Los Niños Services, and I'm very pleased to welcome you to tonight's town hall discussing COVID-19, how people get it, how they transmit it, ways we can prevent it, and also all the questions about vaccines. So I am quite enthusiastic about the Westchester County Department of Health's response to this in partnering with us to provide information. Dr. Hewlett is an expert in infectious diseases from the Department of Health. Kathy Gomez is public health nurse as well. And Ms. Marina Yogos, the Assistant Commissioner in charge of early childhood special needs programs. So thank you so much for joining us. And we'll go through a short presentation, maybe 10 or 15 minutes. And after that, we were happy to respond to any questions that you may have. Please put them in the chat. And we will proceed with Dr. Hewlett. The floor is yours.
Okay, good evening, and thank you, Dr. Mesh. We're looking forward to this presentation, and we are hoping that after the presentation there will be ample time for questions, answers, and discussions. So I'm going to start by sharing my screen here. Go here. Let me start this again here. Okay, can everyone see my screen?
Yes.
Okay, terrific. Slideshow here. Okay, so we'll get started here. And let me adjust this so that I can see the slide text. Okay, so this is an update on COVID-19 and the COVID vaccines. And as Dr. Mesh said, I'm Dr. Dio Hewlett. I'm Deputy Commissioner to the Deputy to the Commissioner of Westchester County Department of Health, and I have with me Public Health Nurse Kathy Gomez and of course Ms. Marina Yogol. And just for background, I thought that I would put this slide in. This was taken back in January of this year, and this was at our Health Department clinic in White Plains. And you see Nurse Kathy Gomez with our colleagues here. And this was when we had received our first shipment of the vaccine. It was a very exciting time. And we got started the very next day with vaccinating people against COVID. And we've been doing that almost every day ever since then. Now, what are some of the clinical manifestations of infection? This is the spectrum of illness. Many people are asymptomatic. This commonly occurs. Asymptomatic people, unfortunately, can unknowingly transmit infection. Most of the time, patients will have mild symptoms, cold-like symptoms, and transmission of infection begins about 2 days prior to the onset of symptoms. And the maximum risk of transmission is from 2 days prior to the symptom onset to about day 4 to 5 after the symptom onset. One of the things that people may not realize is that these coronaviruses have been around for a long time. And in fact, coronaviruses are probably responsible for anywhere between 15 to 30% of the cases of the common cold. And so this is the most common way for this infection to present. Unfortunately, with this particular coronavirus, unlike the earlier coronaviruses, it can cause moderate to severe illness that can be characterized by fever, cough, shortness of breath, chest discomfort, muscle aches, and sometimes gastrointestinal types of symptoms such as diarrhea, vomiting, and sometimes even involvement of the blood vessels. This can be potentially fatal. These are the situations that result in hospitalization. And this is the main thing that we're trying to avoid here, moderate to severe illness. And the vaccines have actually been doing that very, very well. Now, in addition to these three manifestations, we know that in many situations, after people have recovered from acute COVID, they develop long symptoms or long COVID or long hauler symptoms. And this is seen in anywhere from 10 to 30% of individuals, possibly higher the older people are. This is characterized by neurologic symptoms. Sometimes people can have what we call brain fog, and there can be other types of vascular complications. In addition, we know that COVID may be associated with blood clots. And so people have experienced things like heart attacks and blood clots going to the lungs, or pulmonary emboli, or sometimes even strokes. And this is a complication that can occur even after a person has recovered from COVID. Now, COVID-19 most commonly spreads during close contact, particularly when people are within 6 feet of one another. Infections occur mainly through exposure of the respiratory droplets. Now, when the infection first was being described, there was a lot of talk about infection being transmitted on surfaces, and we know that now primarily infection is transmitted via respiratory droplets when these droplets are inhaled or deposited. Spread also can occur from touching surfaces, and spread from touching surfaces is not thought to be a common way that COVID spreads. Now, vaccines, this is a picture of Dr. William Jenner, and he is the person who first developed the smallpox vaccine. He took material from what we call vesicles from a cow, or a person that had cowpox, and actually surmised that this might be similar to smallpox. And this was then used as a vaccine, and it effectively protected people from getting smallpox, which at that time had a very high fatality rate. And he's probably responsible for saving millions of lives, if not around Europe at that time. Now, these are some diseases which we can prevent if we vaccinate. Vaccine preventable diseases, as we call them: polio, whooping cough, measles, mumps, chickenpox, pneumococcal disease, influenza. All of these are diseases that we can prevent if we give vaccines. And a lot of these diseases, fortunately, most of us have never seen. And that's because the vaccines are so effective that they have prevented these diseases and eradicated these diseases from occurring. But what happens when we stop vaccinating? When we stop vaccinating, we start to see outbreaks of vaccine preventable diseases. And back in 2019, there were more than 285 cases of the measles that have been reported in New York since October. Nearly all were associated with people who lived in a certain area of Brooklyn. In California, back in 2010, there were 9,000 cases of the whooping cough, and there were 10 infants that died as a result of this. And this occurred because people decided that they no longer wanted to vaccinate their children. In Rockland County, here in New York, there was an outbreak of the mumps. Same situation. People were not vaccinating their children, and we start to see outbreaks of these diseases which we could prevent. Now, currently for COVID-19, there are 3 vaccines that are available and that we have been using. And here in our Department of Health, we've been using all 3 of these. The Moderna vaccine and the Pfizer-BioNTech vaccine are both what we call mRNA vaccines, or messenger RNA vaccines. And they work by this mechanism of messenger RNA. The Johnson & Johnson, or Janssen vaccine, is a single dose vaccine, and it is based on what we call a viral vector. It's a viral vector vaccine. The Moderna and the Pfizer vaccines require 2 doses. The J&J vaccine is a single dose vaccine. They are all 3 of these vaccines are extremely safe. All 3 vaccines have basically obtained over 90% effectiveness in preventing these 3 things: serious illness, hospitalization, and death. That is essentially the goalpost for us in terms of what we're trying to accomplish with these vaccines. You will hear a lot about breakthrough infections, and the vaccines, unfortunately, are not 100% effective. And so there are some people who will develop breakthrough infections. But fortunately, these breakthrough infections, when they occur in people who have been fully vaccinated, tend to take the form of a common cold. And usually the person gets better after a day or 2. What about herd immunity? We've heard a lot about herd immunity. What can we actually say about herd immunity? Well, some background on herd immunity. You may or may not have heard about the R naught, as we call it. The R naught represents the basic reproduction number of a communicable infectious diseases such as COVID-19. But we knew about the R naught before we knew about COVID. We were referring to this with other communicable diseases like the measles and mumps and other communicable diseases. This represents the average number of people that an infected person is likely to infect. At the beginning of the COVID-19 pandemic, the R naught was estimated to be 2. That is, every infected person would on average pass infection on to 2 others, and the infection would grow wildly with that kind of a ratio. The R naught for influenza is around 2. For measles, it's about 12. These calculations are based on an assumption that all in the population are susceptible. And this is from Dr. Freiberger, who's a mathematician and was published in April of last year. Now, the Delta variant that you've heard a lot about is more easily transmitted. The Delta variant is more than twice as transmissible as the original, what we call wild strain. And the R naught for the Delta variant is now approximately 5. That is, for every 1 person who is infected, they will give that infection or pass that infection on to an average of 5 others, compared to where we were at the beginning of this pandemic, where 1 person would give infection to 2 others. So now we are here, and we had the opportunity, unfortunately, to reach herd immunity several months ago, and we were not able to do that. And so now we have variants that are more easily transmissible, and that's what has led to this current situation. And that's why we are seeing such terrible numbers in certain parts of the country. And keep in mind that the vaccines protect you from hospitalization, severe infections, and death. Now, unvaccinated people will say to us, we'll wait and see. This is what happens when we wait and see. And the question is, have we seen enough yet? In Mississippi and Texas and other places, the hospitals are filling. In certain parts of the country, the rates for children are soaring, and more children are hospitalized with COVID-19 than we've ever seen before. As of last month, there were 4.4 million children that tested positive for COVID. Over 121,000 new cases were added, and this is from the Academy of Pediatrics. And the terrible thing that we're seeing now is that we've got children who are hospitalized and severely ill, and these are children who are not eligible for the vaccine, while their parents and others around them were eligible for the vaccine. And in nearly all of these cases, these children acquired the infection because they shared the household or shared the environment with adults who decided they didn't want to be vaccinated. Now, child COVID cases, these cases have risen exponentially among children in the US since July, and this is from the American Academy of Pediatrics. The group reported 243,373 new cases among children over that past week in July. And after declining in the early part of this summer, the cases in children have increased exponentially, with nearly 500,000 cases occurring over a 2-week period at the end of August. And this is occurring as we're trying to open the schools, as we see right now today. Now, one of the things that we know that's good news is that the Pfizer BioNTech company announced that the results from their pivotal trial of the COVID-19 vaccine in children 5 to 11, that the results were favorable. And this data has been submitted to the FDA. And they were able to show that the vaccine was safe and that it was well tolerated, and that it resulted in a very robust neutralizing antibody response, which is the way that we can determine if the vaccine is likely to work. And so the company has submitted this data to the FDA and to the European medical authorities in Europe. And the expectation is that within the next month, hopefully by the end of October, we will have approval by the FDA so that we can start to vaccinate children from 5 to 11 years of age so that they will be protected and so that they will be able to attend school and participate in other types of activities more safely. That's our hope. So I will go through the last part of the presentation here by talking about some of the myths, and some of you may actually have questions that'll be covered by this, but if not, we will then open this to questions moderated by Dr. Mesh. So this gentleman is Sergeant Joe Friday. Many years ago, he was the star of a television series known as Dragnet. And when he would go out to make investigations of homicides, he would say to the individuals there, just give us the facts. We don't want anything. We just want the facts. So myth number one, I've already had COVID-19, so I won't benefit from the vaccine. Well, this is false. The COVID vaccines are recommended for people who have previously recovered from COVID. And it is recommended that ideally individuals who have COVID should wait 90 days after recovery. But it's not a contraindication. The measured immune responses following the vaccine are up to 4 times the response that are seen following the natural infection. Second myth, since the COVID-19 survival rate is so high, we know the mortality rate's about 2%, so that means 98% survive. So since it's so high, I don't really need a vaccine. Well, that is kind of false, and it's kind of dangerous thinking, because although the survival rate from COVID is 98%, as we mentioned in the earlier slides, 10 to 40% of impacted persons develop long-term symptomatology, long haulers as we call them. Long-term complications can be very debilitating. The complications such as coagulation disorders place the recovering persons at risk for heart attacks, strokes, and neurologic disorders, including loss of taste and smell and chronic fatigue. And recently, they've even described erectile dysfunction as one of the complications. Does COVID-19 vaccine cause sterility? A lot of people, a lot of young women are very worried about this, and this is false. This is a myth that has been perpetuated on the internet. It was claimed that the vaccine spike protein cross-reacts with another protein called syncytin-1 that is important for placental formation. The vaccines do not contain syncytin-1 protein, or does the mRNA encoding for syncytin-1. The vaccine spike protein and syncytin-1 are very different from each other, and there is absolutely no evidence that the vaccine response creates cross-reacting antibodies to syncytin-1. In fact, the American College of Obstetrics and Gynecology recommends the COVID vaccine for women who are pregnant. They recommend the COVID vaccine for women who are contemplating pregnancy. They recommend the COVID vaccine for women who are breastfeeding. They know, and it has been shown, that pregnancy can be associated with dire complications if the pregnant mother gets COVID while during the late part of her pregnancy, especially. And there have been there's been significant morbidity and mortality associated with COVID infection during pregnancy. Another myth, COVID vaccines cause impotence. There's no evidence that the COVID vaccines cause impotence. However, the fact is, those who had COVID-19 were 5.6 times more likely to have erectile dysfunction. And so it has been shown that this is something that actually can be a complication of COVID itself. Now, this coronavirus infection is already known to damage blood vessels all over the body. And the vessels that supply blood to the penis appear to be no exception, because we have blood vessels everywhere. And so these blood vessels, if they are damaged and inflamed, this can result in erectile dysfunction and even impotence. So in summary, all 3 of the COVID-19 vaccines are safe and effective. And when you accept vaccination against a communicable disease like COVID, it protects you and those around you in the herd, such as the children who at this time cannot be vaccinated, And also it protects those with weakened immune systems. So people in your family may have cancer and be undergoing chemotherapy. They may have some sort of a inflammatory disorder and they require high doses of steroids or other types of things which impair their immune system. And so you're doing it for them as well. When the level of herd immunity is reached, the virus has few susceptible hosts and the pandemic will fall under control. And so once we've reached herd immunity, the virus has nowhere to go and it's essentially going to disappear. But we haven't reached that level yet. And right now, because of the high rate of transmissibility of the Delta variant, the herd immunity level is probably over 90%. When vaccination levels remain low, the virus has the opportunity to adapt through mutations, and that's how we got to the Delta variant. The virus has a chance to become more easily transmitted, which is what we've seen with the Delta variant. And there can be overwhelming of the health system, which we are seeing right now in certain parts of the country, especially in states like Texas and some of the states out in the Pacific Northwest and in Florida and Alabama. So I will end at this point, and I'm going to turn the discussion over to Dr. Mesh, and Ms. Kathy Gomez is going to join me in trying to address any of the questions that you might have, and we'll try to also address any of the comments that you might have as well. So thank you very much for giving us this opportunity to speak with you. It's very important for us to talk with people in the community. We want people to have a good understanding of COVID and about the COVID vaccine. And we want to try to address any questions that you might have about the vaccine. Here at our health department, Ms. Gomez and the team have vaccinated over 60,000 people in Westchester County. And so she has a wealth of experience in administering the vaccine and watching people after they've received the vaccine in our clinics all over the county. So I'll turn it over to Dr. Mesh, and we'll try to answer your questions now. Thank you.
Okay, great. Thank you, Dr. Hewlett. So that was a lot of information in a short amount of time. And we do have some important questions. So one of the central questions is people hear a lot of things on the internet. And then it sounds like your information is coming from the scientific community. So who should people listen to and why?
I'll let Ms. Gomez take that first, and then I'll chime in.
So people should listen to the science, right? Because the science is proven. And in the internet, anybody can say anything. And things get turned around, or they hear that something happened with somebody and they just mix it up. Even with what's happening right now with impotence, it's known to be caused by the virus, not by the vaccine, but people change it around. And so it's understandable for anybody that is not aware of the science to get nervous and think that it's true and be afraid to accept the vaccine. So that's why we're here, to try to help and clarify.
And we here at the health department, we're concerned about the health of everyone. As doctors and nurses, we've taken oaths that we are acting in the interest of patients because we want to make sure that people stay healthy. And that's why we're giving you as much factual information as we can.
Okay, very good. So in terms of the pregnant women, women who have given birth, have newborns, should they breastfeed? You talked about this briefly, but there are a lot of women of childbearing age who are very concerned about the possible effect of the vaccine. So what evidence do we have to try to make them feel more comfortable about what we know already?
Sure, that's a fair question. While the vaccines were undergoing testing, there were probably at least 40 to 50,000 people that were included in the initial trials, as we call them, for the vaccine. And some of the people that were included in those trials turned out to be pregnant. And they weren't necessarily trying to include people who were pregnant, but some people were pregnant. And it was found out after they enrolled in the trial and had received the vaccine that they were in fact pregnant. And so because of the guidance from FDA and the other regulatory agencies, you're obligated then to follow those women, and you followed their childbirth. And the children were then checked to see if anything terrible happened to these children. And they found that nothing terrible did happen there were probably thousands of children who were born to women who received the vaccine during the trials. They also found that there was nothing untoward that happened to the women who received it during their pregnancy. The other piece that's important is that for the newborns, breastfeeding actually is a very important way to pass protection from the mother to the baby. And we've known that long before COVID. We know that the first amount of milk that comes out of the woman's breast that goes into the baby, the colostrum, as they call it, that has a high amount of what we call antibody. And that is very helpful for the baby. And so if the woman has been vaccinated with the COVID vaccine, some of her protection from receiving the vaccine is going to be passed on to her baby, who is not eligible to receive the vaccine. But we know that these young infants are at risk for developing infection. And the final piece here that we touched on is the, I guess you would call them the advisory group or the authoritative group for obstetrics, the American College of Obstetrics and Gynecology. They publicly stated several months ago, and they published it in their journal and in their guidelines. We recommend that women during pregnancy should receive this vaccine. We recommend that if you're contemplating pregnancy, you should receive it. And they also said that it was important for women to receive it if they were breastfeeding and it was safe. And they also mentioned, and this is the other important part that I mentioned during the talk, COVID can be very dangerous if it occurs during pregnancy, especially in a woman who is during the late stages of pregnancy. And there have been cases of miscarriage, there have been cases of premature births, and also stillbirths that have been attributed to the COVID occurring during the pregnancy. And a lot of that is due to the fact that it affects the blood vessels. And so you have blood vessels going to the placenta. And so this can occur. And so for that reason, I think we want to encourage women to take the vaccine if they are pregnant, because it has been recommended.
So what I'm hearing is that there's huge negatives of COVID-19 in pregnant women and women who have newborns. And then there's virtually no negatives to the vaccine. It's protective.
That's correct.
Mm-hmm. And so another question that's a very hot topic is how, since they developed this vaccine so quick, how could we know that it's safe? Most vaccines take a long time to develop. How could they develop this thing so quickly?
I don't know. Ms. Gomez, do you want to tackle that?
So they started the work on this vaccine in like 2003 with SARS-1. Then in 2012, they continued with MERS. And when they stopped, it was because they no longer needed it. If the virus disappeared, they no longer needed, but they still had the information. So it was easy to continue. In 2020, we already had the genotype and the information to continue for the virus vaccine to fight the virus. And so that's how it was quickly able to be available for all of us. Mm-hmm. And it was tested phase 3, mm-hmm. And it was medical, it was what is the word that I'm trying to say? It was evaluated by New York or the USA. Mm-hmm. What was the other one?
World Health Organization?
Yes, the European FDA, yeah. So, reviewed by the ACIP, okay. All of those organizations.
So we were prepared for it. We had all the prep work for it.
Yeah, so it didn't start a year ago, it started 20 years
No.
ago, but we just added on to finish up the vaccine production.
That's correct.
Mm-hmm. And then another important question is parents are concerned about their children. So how can they be assured that this is safe and effective for, let's say, 12 and older? And then now this new age group is going to be approved soon, 5 to 11. So how can they be assured that it's safe and effective?
Well, as Kathy mentioned, there were clinical trials, and so the companies have been required to do clinical trials, and the initial clinical trials included more than, I think, 50,000 people who were enrolled. There were clinical trials that were done to look at the safety and effectiveness and tolerability in children between the ages of 12 and 16. And the company submitted the data to the Federal Food and Drug Administration. And they reviewed all of that data, and they said, we have found that this vaccine works in these children. We found that it is safe. So it's not just saying that, it's actually showing when it's given to children. And there were thousands of children who were part of this of these trials. And right now, they are reviewing the data on the children who are between the ages of 5 and 11. And we are hoping that they'll come up with the same conclusion and that the vaccine will be available for them very soon.
Just a reminder for parents that you can feel free to write a question in the chat or the Q&A, and then we can respond to those. So another question parents have is, okay, well, they haven't found a problem yet, but maybe they'll find a problem in the future. So maybe I shouldn't take the vaccine, I should wait and see.
Well, I think what we respond to with that is that nearly all of the serious problems associated with vaccines occur within the first roughly 2 to 3 months. So if you don't see a problem within that period of time, it's very unusual that you're going to see a problem later on. Now, as an added bit of comfort, the safety data is being collected out to 2 years after the trials have ended. So after the last person has completed the trial, the very last person, they will be followed for 2 years from that point in time. And so people are still being followed. So we're roughly a little over a year out, because they started these trials, I believe, in July of 2020. And so we're about a year out right now. So they're constantly collecting data. In addition, we have large databases that collect adverse events. So anyone who has even something that is viewed as a minor side effect of the vaccine, we, as the doctors and the nurses who are involved with giving the vaccines, we have to file reports to say this person had this occur. And so that database is being constantly updated to let us know if there are any safety signals, as we call them.
Okay, so another question is, hey, I had COVID, I have antibodies, so I'm protected. Why should I risk the vaccine?
So it's been shown that the vaccine helps with the antibodies. It helps protect you 4 times more than just the natural antibodies that you create with the virus alone. And there's longer, you have a longer duration of protection as well. That's been shown in the studies.
Mm-hmm. And I think we kind of covered this one, but what about the concerns about possible long-term side effects or issues with vaccine? How does that compare to the possible risks of COVID?
Well, I think that one is much more likely to get COVID than to have a serious adverse reaction from the vaccines. With some of the serious adverse events, as we call them, those have occurred at rates of sometimes maybe 7 to 10 per million over a million doses. And so those are some of the odds in terms of the likelihood of having an adverse event. We see the hospitals filling up right now with people who have been unvaccinated in the various parts of the country. And so your risk for getting COVID is actually very, very high, especially with the Delta variant. So if you happen to be in close proximity to someone who has the Delta variant, especially if you're in a situation where people aren't wearing masks and a lot of people don't want to wear masks, then you are at a higher risk for developing COVID. And we know that just with the 2% figure, 2% versus something like a few out of a million, there's a big, big difference there.
So what I'm hearing is that if you go unprotected now, you've got a large possibility that you can get COVID. And if you get COVID and you're not vaccinated, there's a much higher likelihood you could have serious disease or death.
That is correct.
In terms of the future, no one can know 20 to 30 years, but what I heard from you is that research shows over decades that if side effects are not present in the first couple of months, it's very, very unlikely that you would see adverse effects over the years. Is that right?
Correct. Yes, that's correct.
And if you get COVID, you can have long-term effects.
Mm-hmm. Could you talk about that just a little bit? So the long haul, you mentioned that in the presentation, Dr. Hewlett, but maybe Kathy, you could just add a little bit of what that's like.
Sure. So I actually know people that have had COVID, and some of them since March of last year cannot taste. Some people, this young man, 30 years old, never had any health issues. Right now, he has a heart condition because he had COVID. He wasn't vaccinated. He gets out of breath, short of breath easily. So he has to be followed up by a cardiologist and is on medication. So I've known people that have had it young and older, but you definitely can end up with a lot of chronic issues, fatigue, chronic fatigue. There are people that have had it and they just can never feel, they don't feel the same as before they had the virus.
So I'm hearing serious issues, not just mild issues.
Right, and one of the things we'll add is that this is so common, long COVID is so common that there have been centers, clinics that have been set up in various hospitals around the country to deal with people that have long COVID. And in fact, a paper came out just a few weeks ago saying that this is probably the next healthcare crisis that we're going to face, because we have such a large number of people here in the United States who have long COVID, and COVID has hit people in their prime working years, people in their 40s and early 50s who now are debilitated.
So we'll see if there's other questions. Otherwise, I think we'll be able to wind down soon. And from the slides earlier, I saw quite a high percentage of folks who had long COVID. So there's right. It's not like 1%. It was
10
much,
to 40%.
Yeah, that's a very, very high number. So I'm hearing serious, take it seriously. And if you didn't have symptoms, or if you got over your symptoms, consider yourself lucky. But many, many people are not so fortunate.
And the other thing which I think people should bear in mind is looking at our children. In Westchester County last year, I think we had close to 50 children who had serious multi-system inflammatory disease. And these children had to be in the ICU. Some of these children had neurologic problems. Some of them had heart problems, as Kathy mentioned. And these are very small children. So we really don't know what the consequences are going to be for these children once they get into their teenage years and further along. We don't know whether those who had neurologic involvement are going to have permanent problems. Could they have cognitive problems? Could they have learning disabilities? And we want to protect our children. And the way to protect our children and to prevent them from getting this infection and possibly having this multi-system disorder is to get vaccinated ourselves and to make sure that all the people who are around our children are also vaccinated.
And we didn't speak about masks much, but do you want to mention some thoughts on masks?
Sure, we are advocates of masking. And so even though we are vaccinated, when we are at work at the clinic, we are wearing our masks when we're in those common areas that we share with other colleagues and the areas that we share with patients. We should be masked when we're in indoor gatherings, in public places, public buildings, because we know that the mask will prevent the spread or limit the spread of the infection if we happen to have the infection. And as we showed in some of the slides, even though we're vaccinated, there is a possibility that people can have breakthrough infections. And so it will prevent that. Likewise, if there are people around us who have the infection, it will prevent or limit the risk of us getting the infection from them as well.
So what I'm hearing is also the purpose for vaccines and masks and social distancing is not just a personal choice about protecting yourself, it's about protecting everyone else that you're around, your loved ones,
That's concerned.
work colleagues, and anyone else you come in contact with.
That is correct. And that's the concept of herd immunity.
Great. Are there any concluding thoughts anyone would like to share? Commissioner Yogel?
I think there's another question in the chat.
Okay. Vaccine efficiency is waning over time. Why would somebody whose natural antibodies, whose antibodies are getting strong, need to risk getting the vaccine? So I'd asked this earlier to you. Some people are concerned, hey, I already, I have natural antibodies. Why should I get the vaccine? But why don't we go over that one more time?
One of the reasons is that if you have natural antibody, and if you got the infection, let's just say a year ago, it was not against the Delta variant. And so we are seeing reinfection, and we're actually seeing serious disease in people who had the natural infection before, and now they're getting infected with the Delta variant. One of the things that we know as a fact is that current vaccines actually do cover us quite well against the Delta variant as well as against the wild strain. And so I think that that's one of the reasons for taking the vaccine. And I think, as we said before, if we look at the numbers and we talk about what the risks are of being exposed to COVID versus the risk of having something untoward happen as a result of the vaccine, we're talking about a very, very small risk that's associated with the vaccines, a minimal risk associated with the vaccines.
So I'm hearing even if you have natural antibodies, you're at risk for getting sick or possibly dying, but with vaccines that there's almost no chance
that hasn't
of
been
dying.
happening. The current pandemic is a pandemic among unvaccinated. And that's because of this Delta variant that is present. And this Delta variant is significantly different than the wild strain, which was what was circulating back in March and April of 2020.
And also, it seems that this person is asking, or maybe thinking, that antibodies will increase in potency over time. Is that true, or do the antibodies weaken over time?
They actually go down, and that's why there's a lot of discussion right now around whether there's going to be a need for boosters. There are talks going on today, in fact, about whether boosters should be offered. Those who are what we call immunocompromised, those individuals are being offered a third dose of the vaccine because they can't really produce as much in the way of antibody. And so that's something that we've been doing at the health department, giving the third doses for the last several weeks.
And the other aspect of the question is, why would somebody risk getting the vaccine if they have antibodies? So they're hearing that there's like a large risk with the vaccine. What I heard from you clearly is that the risk from the vaccine is extremely, extremely small, in minuscule in terms of any kinds of effects based on scientific studies where they're looking at evidence, not where people are giving their opinions on the internet.
That is correct. Now, we acknowledge the fact that most people that get the vaccine, and I received 2 doses of the vaccine, most of the people, all of the people in my immediate family received the vaccine. My oldest grandson, who's 16 years old, he received the vaccine, and just about everybody gets a sore arm. There's no denying that. You get a sore arm similar to what you get with the flu. Some people will get some fatigue and tiredness after they receive the second dose. There are some people who will develop a little bit of fever and just not feeling that well a day or so after they receive the second dose. And that's what we call reactogenicity. That's actually a good thing. So think about getting the vaccine does the same to your immune system as exercising in the gym does for your physical conditioning. People say no pain, no gain. If you have a little bit of discomfort after you've had the vaccine, that's actually a good thing because your immune system is being exercised. Your immune system is being conditioned so that if you are going to be attacked by this COVID virus later on, your immune system is ready to fight it.
And this is something that's a day or two, but it's not any kind of long-term thing to be concerned of based on studies.
That's correct.
Okay. And where can people go for further information if they have further questions?
You can contact us at the Department of Health. I can give the phone number and I can give the addresses. So we have 2 locations. We have 134 Court Street, and we're actually administering the vaccines there from 10 to 1 on Fridays. No appointment necessary, and we're administering all 3, Pfizer, Moderna, or Janssen.
Court Street in White Plains?
134 Court Street.
White Plains.
White Plains. And we're also at 20 South Broadway, and that's in Yonkers on the 2nd floor. We're there Mondays and Thursdays from 4 to 7 p.m.
Monday and Thursday.
Mondays and Thursdays, yes. And our phone number is 914-995-5800.
Excellent. So any other concluding thoughts from the panel?
Scott, I just wanted to offer to our families of your program in Los Niños. These children are under the age of 3, and the early intervention program is very committed to ensuring that we can continue to safely provide in-person service. So keeping them in the program, getting them into the program, getting them bused in a safe manner is our priority. And the idea here is that they'll be the safest if we are all vaccinated and we can keep them safe that way. So ensuring this particular population who has special needs is pretty vulnerable. So there really has to be a commitment here to keep these kids safe. And that's what we are really saying. And the best way to do it is to follow all the precautions that we need to, get a vaccine, and ensure that our children who need to be served, who have special needs, can get those services without interruption to the best of our ability.
And then when therapists are providing services in a center or in a home in person, then they're required to wear masks.
Therapists are required to wear masks. Therapists are required to social distance. Parents are required to ensure that the family is aware of all the precautions required in order to do that in-person service. Yes, and while we have telehealth as an option, our goal is to get that service in person because these children are little. And the most effective intervention is to do it in person. So we want to ensure that with healthy, the healthiest thing to do in order for us to continue on that path is to, adults get vaccinated. I mean, that's the idea here. That's the key. So.
And how has all those measures worked in terms of providing services during the pandemic?
We have been doing very well with kids being able to get to school. We're busing kids. We are doing very well with in-person services at home. And we'd like to keep that sort of like on that trajectory. So it's important, everyone has to do their part, so to speak. And these kids under the age of 3 have the most vulnerability. It's hard enough under the age of 5, but under the age of 3 is difficult. And we have some pretty medically fragile children who really, it's important for them to get their services in person. So we're doing well on that end in terms of ensuring it. So that's why we need all the assistance from the adults around these kids to keep them safe as we try to provide them services.
And Ms. Gomez, Dr. Hewlett, anything else to add before we close?
No, nothing else. Thank you very much.
Thank you. And I would like to let everybody that is thinking about receiving the vaccine, that's nervous, know that we will monitor you. We will watch you after we give you the vaccine. We ask you a series of questions, make sure that you're eligible, and that you shouldn't be at risk when you receive the vaccine. We will watch you and make sure that you're okay before you leave us.
Thank you so much, parents,
Okay.
for joining and participating. And thank you so much, Department of Health, for providing this great panel and information.
Thank you.
Have a good evening.
Bye-bye.